here's the typical workflow in a therapy department. So you're going to have basically some type of prescription or working document to get you started on the simulation. Treatment plans are going to get done for IMRT, pre-treatment QA. Then once the patient comes in, basically set up generally some pre-treatment imaging, registration, and then treatment delivery. And a lot of the treatment machines today, there's also surface guidance that goes along with this. It's becoming more and more popular. So let's throw that in there. So then Adaptivo is going to fall right after the treatment delivery. We're actually going to collect some information during that delivery and then do an assessment post-treatment. Hopefully, we help answer that question of whether or not the patient needs maybe some type of setup adjustment, or worst case scenario, maybe the treatment needs to be changed. So that's sort of the goal here. So the in vivo module is fully automated. It does a discovery after the treatment is completed, and then it automatically processes that data. It does work for arc-based treatments and static fields, and it's basically using the portal imager. It's transit-based. So in other words, we're analyzing the signal after it reaches the panel. So this is transit as the beam passes through the patient. It's daily exit tracking. So essentially, we have the image panel that has been calibrated to a particular calibration unit, and we're going to basically do an analysis based on that calibration against the treatment plan, and you can also do image to image, which we'll talk about. So you're monitoring the beam delivery, and we give you a gamma analysis that's basically a measured to predicted, and we also have a measured reference to measured daily, and we'll talk about that a little more in depth. You get a sine gamma as well, which is hot and cold. Think that. So more signal, less signal, higher dose, less dose. Automatic notifications of, we say deviations, but it's essentially anything we detect that breaks the criteria that you will set, we'll give you a notification for. And then software can automatically generate reports, and those can be uploaded to your R&B system if you choose. So currently, the machines supported by Adaptivo include the Varian C-arm type Linacs, your TrueBeams, both TrueBeam, TrueBeam Edge, the iX series, Trilogy, VitalBeam, etc. So what are the prerequisites to essentially use the in vivo portion? You need essentially a calibrated EPID. So once the EPID is calibrated, this is kind of the key to this entire program. Then you need a beam model, you need the files from the treatment planning system consisting of the RT plan, RT structures, CTs, etc. Again, those are pulled automatically with that discovery process. You don't have to export those. And then we need the machine records as the patient's treated. So in the Varian ARIA situation, that's your RT record files. And then again, that discovery and retrieval is automatic. So then this is a QA during the actual dose delivery. So again, that transit analysis, and the things that it's going to detect are essentially things that would affect the path length or effective path length. And we'll talk about this a little bit further in a few of the slides that remain. So some of the things that you'd be looking for, sort of a patient misalignment, anatomical changes, missing bolus, or if somebody put bolus on that shouldn't be there, or air cavities where you don't expect the air to be, like rectum full of air. In vivo will definitely potentially detect that. And then this helps ensure the correct delivery to the patient. First, let's talk about the in vivo, what we'll call the relative comparison module. This uses the portal imager, and again, it does work for arc-based treatments and static fields. And essentially what this is a reference measured portal is compared to essentially the subsequent treatment fractions. So in this case, the default reference would be fraction 1. So this will become the basis for comparison, and then subsequent treatment images collected on the imager panel will be compared to that image. Any differences that break the established criteria that's set will essentially trigger an alert. So it's going to monitor the consistency of that beam delivery across fractions. So the key would be doing, whatever image guidance that you would do that you're comfortable that fraction 1 is essentially the best fraction to use. Sometimes, based on your pretreatment image guidance, maybe fraction 1 is not the best image. Some people revert to fraction 2 or 3. You can change that reference fraction if deemed necessary. So you do get the sine gamma analysis that we talked about. You get the gamma matrix, which I'm going to show you some images of later. It's an invaluable tool to basically assess a bunch of different gamma criteria all at once, so you can see when it's starting to fall off the cliff. And we'll get into that just a little bit more here in a few slides. You do get those automatic notifications of the deviations based on your set established thresholds, and then the reports. So then the predicted module, same, it's going to use the portal imager, but the difference here is each fraction's measured portal, so the collected signal is now going to be compared to a predicted portal. So get the treatment plan. The in vivo module uses that treatment plan information to predict what that portal image is going to look like. So then each fraction is compared to the predicted portal images. So with that, you're going to be able to monitor, again, the beam delivery across the fractions versus those predicted based on the predicted portals, essentially based on the treatment plan. And again, just like the relative mode, you're going to get the hot and cold signed gamma, the gamma matrix, automatic notifications, and the generation of reports. And both of these modules, if you have predicted module commissioned, you'll get both results, predicted and relative, so that you can actually compare the results between the two. And a lot of times you're going to see that they track pretty consistently. So with this, you're going to get a lot of temporal information on the initial dashboard when you come in to review a patient's treatment. So as the patient progresses through treatment, you'll be able to get some of the information that you're seeing here. So these are just snapshots out of the dashboard that's showing essentially fractions 1 through 10 with an average after 5 and an average after 10, where it takes basically those 5 fractions and gives you that average. Essentially looking at this across fractions, you're going to be able to assess whether or not the areas of disagreement are random or whether they're systematic. And then are the areas of disagreement getting bigger or smaller as fractions progress? And if we look at this is just 2 arcs. So you got beam 1, beam 2, and you can see that there is an area in the superior aspect of the field that shows up consistently for that second arc. So this might be an area, depending on the anatomical location that is being treated, maybe you want to go look at this and see if this is something anatomically, if this is a abdomen treatment or things going on in and around the diaphragm, potentially what's causing this, head and neck, is there potentially a shoulder issue, that type thing. So we also give you a set of trend lines for the gamma results, where you can actually, this case has 4 arcs. You can see all of those arcs in the predicted mode. You can see the results across fractions. This is a pretty helpful view. Just like that temporal information we were just looking at, you get a sense of when things are starting to deteriorate, and then you get a beam by beam analysis as well, so that you can actually see if some beams are more sensitive to what is being detected than others, and then analyzing those particular beams, you can basically zero in on whether or not there's something that requires some action. So then I mentioned the gamma matrix. So essentially what this is, you're going to get a pass or fail based on the criteria that is set. And I mean, you can set essentially 3% 3 millimeters or 5% 3 millimeters as sort of your default criteria. And when it breaks that, you will get an alert. But the gamma matrix also gives you a lot of information to understand, as the patient progresses through treatment, if you do get an alert, you can actually see whether or not things are starting to fall off the cliff and how badly. And again, these numbers just result or are a result of that gamma analysis. So in a particular case, just to drill home the point of gamma, which I'm sure most of you know better than I do, but it would be if you had all of your pixels that basically failed the dose difference at 3.1%, you would get 100% failure. But yet the dose difference is only 3.1%. Same thing with 2 millimeters. If all the pixels were 2.1 millimeters greater, 100% of the pixels would fail. So essentially that's one of the things with gamma to keep in mind. Even if you had 100% fail, having the gamma matrix sort of gives you a bigger snapshot of what's going on across all of those results, and you can kind of see where it's really fallen off the cliff. And you can see in this example, fraction 1, at 1%, 1 millimeter, you're at 77, and then by the time you get to fraction 31, it's dropped to 34.19, and you also see the shift across basically the matrix. And this would be, you know, an indication that you probably have something that you need to investigate. So then let's talk about the hot coal, because this is one of the tools that I find the most useful in essentially getting into the right frame of mind to actually analyze these results. Because again, you're looking at an exit signal that isn't easily translatable to dose in the patient. It's actually the signal on the panel, and there's a lot of things, as we all know, that can affect that. So hot versus cold. So the top image is hot, the bottom image is cold. So essentially, think in terms like this: higher portal dose, lower portal dose, shorter path length, longer path length. So shorter when it's hot, longer when it's cold, and then essentially shorter effective path length or longer effective path length. So what are some of the things across the cases that you would be looking for? It would be things like this. So I sort of color-coded these things as far as what you would expect. And again, this depends on the anatomical site being treated. But if you have some type of volume, weight or volume loss, the signal is going to be hotter. Weight or volume gain, signal is going to be cold. Patient misalignment, it can go either way, because if you move and the beam, you know, should be passing through, say, the patient in like a hip treatment or an extremity, and now it's out in air, you're going to get a hot signal. Or if it's supposed to be out in air and essentially the patient's moved, it may be a little cold. Or if, you know, patients, again, had, depending on the anatomical site, you know, if there's a slope, like in a breast treatment, whatever, we're going to show one of those cases. A small misalignment can trip you one way or the other. An extremely full bladder, and some of the pelvis cases where bladder shouldn't be that full, it will trigger. And then of course air or missing bolus. And there's a number of other things that could show up here as well. If there's anything left on the couch that shouldn't be there, that happens to be in the way of that treatment beam before it hits the panel, will also trigger basically an alert. So then let's talk a little more about, you know, some of the ways to use the tool. So this is a breast treatment, and I just pulled fractions 6 through 15 just so that we could look at a couple of things here. And you can see that if you look across the fractions, it is a little bit systematic in the superior aspect of the field. So this could essentially relate to arm positioning, or if they're, you know, on a breastboard or in some type of cradle, the way the tissues, you know, line on that particular day. And you can see that as they progress through treatment, the therapists were working to basically get the patient to settle in this case and improve that setup. And by fraction 12, they got to pretty good space and still had a little area of disagreement that's cold up in that superior aspect, but it's actually improved quite a bit. And for a breast case, you know, this is a pretty good improvement. So let's take a look at fraction 9 a little closer. So the next slide, we're going to actually analyze one of the beams on 9 just to show you the tools within the system. So again, these are the results for 9. And these are essentially the results, and this is a slide out of a newer version of our software that hopefully you will see soon. But the tools are the same in the existing version. This just has movable profiles in the particular slide that I'm showing you. But with this, let's take a look at the alignment. So how do you tell alignment with this? It's actually fairly easy, especially with a breast treatment. So looking at essentially the setup on the superior aspect, you can see that it actually does not align quite as one would expect. It's a little deeper cut or bite, fields a little deeper in the breast on the actual portal dose, which is on the right. So you are essentially getting this cold signal where, the breast being cone shaped gets a little thicker. So as the patients, move further into the treatment beam, we get a failure. So with this one actually has approximately a 20% CU difference. If you look at the CU values, this, may be something, if it was trending day to day, that one might want to look at. So by the time they got to fraction 15, this had cleaned up where the therapists were kind of paying attention each day, trying to get this patient to settle and improving that setup. And note the improvement in the breast alignment. So in that superior aspect, now it's lined up and it looks really good. The CU difference, if you look at the CU values just based on the curves, it is greatly improved. And you have just that little cold spot and then a couple of, hot spots. And this can be just related to the panel calibration or what have you outside the breast in air. So basically, one area that I'd like to focus on is the inferior aspect. And you can see I put a circle here where we're at -10 on the scale. Because of the magnification and not being able to fit the whole portal on the panel, it's clipping just the portal image, the inferior aspect of the breast. So with this signal running a little bit hotter, maybe the therapist, you could recommend that they move the panel just to catch that inferior aspect a little more, since you've got the top part, covered and it's setting up nicely. One of the things that could be done in this is just to collect a little more on this aspect of the treatment portal. So it would be just moving that panel just a bit inferiorly, if that makes sense. But overall, nice change with the corrections that they made. So with the software, you do get automatic notifications. And if you're a person that loves to have alerts sent to you for a variety of things, it is very configurable. And you can get emails sent directly to your corporate email, or you can get in-app notifications where when you go into the dashboard, you'll get an alert area like this where it'll basically tell you how many alerts you have for a particular patient. You can basically click on those and navigate to the fraction of interest, if you will. But these are very configurable. You can actually start out, with very few notifications or a lot, depending on, what you're comfortable with. And if you decide you're getting too many notifications, you can actually come back in and tweak the stuff. And this is individual, so you can set this up based on your user preferences. So then let's do some takeaways. So where does Adaptivo fit into the therapy process? So it's in that treatment analysis space. So collecting the information automatically during treatment, performing that analysis, and it's ready shortly after the treatment. As soon as that RT record hits basically the image server, it's going to be detected by Adaptivo, picked up and analyzed, certainly within 15 to 20 minutes of the treatment being completed. What are the basic capabilities of the in vivo portion in Adaptivo? We went over kind of what it can detect, which treatment machines are currently supported. So those are those Varian C-arm Linacs. Halcyon is definitely on the roadmap, but currently not supported by the product, but definitely on the roadmap. And then what types of issues does the in vivo module identify? So again, it's going to be those path length changes, and then basically using your ancillary information, be that your surface imaging, pre-treatment image guidance, to sort of answer the questions. And the goal is to make the tool work for you, not against you. So for those that would potentially be looking at purchasing and starting the program, we recommend starting small, picking out the cases that you're interested in, and ramping up as you get comfortable essentially with the criteria that you would want to set in your clinic. and then basically work to bring essentially the whole team into the program, because you'll find a lot of times that the therapists get a little apprehensive with packages like this being put on the machine with the big brother aspect, but people that have used the tool find it to be quite the opposite. If you engage the therapist and basically get them used to looking at some of the results, you'll find that they actually take some of the information with the breast treatments and consultation with the physicist, physician. You can basically improve those setups. So with that, we do have a couple of complementary products. So one of the things with exit dosimetry analysis, you always have the question, is the alert caused by something with the patient, or did the potentially something with the machine, contribute to the alert? The LinacView package we have basically helps answer that question by doing a log file based analysis, and will give you some insights into that actual treatment delivery and whether or not you had something, take place during the delivery with the machine that could have contributed to the result. Another complementary product is I Am Sure 3D software. This is basically a Monte Carlo based second check software that does a little more than just check the MUs. You're checking your beam model, so it's going to give you basically any flags that you could potentially get around the deliverability of a particular treatment plan based on your beam model. I thank you for your attention, and hopefully you found the information helpful. And again, you can reach out to my email at Standard Imaging or contact your individual sales rep if you want any more information on Adaptivo. And thank you very much, and I hope you have a good rest of the day or evening, depending on where you are. Thank you very much.